I love surgery. I like to do something and see that it's changed, like right away. I want to take that hernia and get rid of it in the next hour. As a general surgeon, I'll do anything: appies and gallbladders, hernias, stomach surgeries for acid reflux, thyroids, parathyroids, melanomas. So it's just tons of variety. The World Health Organization surgical checklist, it kind of helps us to settle and stop right before any procedures are done, so that everybody in the operating room gets focused on the case, and allows us to really take care of any other distractions and just really focus, go through what we're going to do, talk about anything that we expect to be an issue or not, and then even discuss post-operative recovery as well.
We use it to make sure that we have all the pertinent information about the patient that we need to know before we start the surgery, and also to make sure all of our equipment is working and available to us, and if there's any implants needed, that those are also available, and that any kind of x-ray imaging or films or studies are available that we might need to reference during the case. It goes back to making sure that there aren't any gaps in care and that the patient's getting the best care possible in a timely manner.
This is kind of a big deal for someone to say, you know what, I want you to perform a procedure on me. I mean, to actually make an incision. That's a big deal for a patient to entrust you to do that. So you're ultimately, I'm accountable to that patient for any, planning, safety for sure.
When you stand there in the timeout and everybody's paying attention, and they're kind of going through a checklist in their mind that tells them that, yeah, okay, I have everything that I need to safely take care of this patient. It makes us feel like we're mutually responsible for all the different components, just as much responsibility as the other team member for the care of this patient.
Now it's not just one individual, it's an entire team, so it's an entire safety net for patients.
I think accountability is important because we're really considered advocates for the patient, because in the operating room the patients are a lot of times sedated or unconscious, and so we have to stand in for them, to stand up for them because they can't stand up for themselves.
That's what medicine's all about, really, is if there's something that you say you're going to do or something that you need to do, you're going to do it.